You know, I wish this kind of training had been given to me 20 years ago when I was training to be a pediatrician. And somehow I know Vibha has also spoken on this, though I have not read her interview because I didn't want to get biased. I know that she's spoken in the same vein, so I wanted to see how I could do this a little differently, how I could share my story. And I very strongly feel that somewhere along the way we must incorporate the principles of narrative therapy in a medical curriculum. So I decided to write a letter to the Indian Academy of Paediatrics. So I'm just going to read out my letter, and there are just a few pictures to sort of help along the way. It's not like a full-on PowerPoint presentation. Dear fellow academicians, this year I underwent the mental health training program at Ummeed. And I want to tell you about my experience and how it has brought about this subtle change in the way I practice and approach my patients. I like to call it the paradigm shift. As doctors, we are regarded as experts. And at the very outset, I had to challenge this dominant discourse. What I learned was that everyone is an expert of their own life, and that they have agency to decide how they want their life to be led. Even their diseases and the symptoms of their diseases are theirs, and it is up to them to figure out what they want to do with these symptoms and the effect of these on their body. It got me to think of ways in which I can incorporate these concepts in my regular consultations. One of the very first patients was a little boy, around 4 years old, experiencing hyperactive airway disease. His mom had already been to a few doctors who had labeled the child as asthmatic, and he was taking regular inhalers. I could see that she was extremely distressed, and she just couldn't believe that her child had something that he would have to take lifelong medication for. And this was something just too terrible for her. So I decided not to talk about, what medication is, the medication right or wrong, and started exploring what her feelings were about her experience with what has happened till now. So we started exploring what she thought was happening to her son. The biggest dilemma was that she didn't want to foresee a future for him taking the pump for the rest of his life. But at the same time, she did not want him to suffer from breathlessness. There was a feeling of helplessness and a loss of control. Somehow I needed to make her feel more in power of herself, give her the agency over the supposed monster that had come into their life. Any battle needs that we understand the enemy better. So we decided to characterize and understand breathlessness. I helped her to understand the pathophysiological process of bronchospasm. What happens when you have bronchospasm? What are the things that trigger bronchospasm? What are the various medicines that may help it? What are the various things that can prevent it? And as she was talking more and more about it, I could see, even in her body language, how her posture was started, because now it was something that had even slightly been externalized, and she was getting more of a sense of the understanding of what was really happening, rather than just being told, he has asthma, he has to be taking this medication. So over the next few months, mom and son were able to re-author what position hyperactive airway disease had in their lives and how they wanted to deal with it. I found her to be more comfortable with its presence. After this, she actually used to just, speak to me once in a while and say, this is what I'm doing, I've started this inhaler now, I've stopped this inhaler. So she felt more in control after that. I know I've shared this story before, but I've also worked in the same narrative principles in another area. So another area of my practice where I found narrative concepts extremely useful is in my handling of newly born moms. I call the moms newly born because it is only when the child is born that a mother is born. The arrival of motherhood is a huge change in their lives, and much as they're excited about their little baby, they're not quite sure this is what they truly signed up for. The incessant breastfeeding, the nappy changing, the never being able to get a full night's sleep, and every japabai, friendly neighborhood aunt and family member offering free, unwanted advice, trying to convince them that they're going to fail. That first 15-day checkup is like the worst exam they're ever going to give. They're dreading me putting the baby on the weighing machine. At this point, asking a few simple questions in front of that mother-in-law work like magic. Questions like, how do you do it? And this is where Ravi resonates in my head. What gives you the energy and the willpower to keep at it night after night? Who else would be very proud of you to know that you were doing this? What were the hopes and dreams you had when you first came to know that you were pregnant? And many times I don't get much of an answer, just a shrug or an I don't know. But I think the very asking of these beautiful narrative questions gets them to think, gets mom-in-law to think, and look at things with a different perspective. Suddenly someone is acknowledging their struggles, their efforts. And just that feeling, I think, empowers them. I did my pediatric training from a very hardcore school that believes that breast is best. And of course, breast is the best. But it's not the only truth. Whenever I've explored options of giving top feed, your top feed to the child, or expressing milk and letting either the father or somebody else do the feed, I have found that just knowing that they have options is a huge relief for these people. It takes off the load from their minds, and they're able to actually produce milk more efficiently. My position as an expert, of course, has its advantage, because if I'm okay with it, then it must be okay. They do want to know the actual medical facts behind the stance taken. I know if my body language is relaxed while I'm having this conversation, they will feel relaxed. And this is what something narrative has taught me to do. And it helps immensely to alleviate some of the guilt that has been building up inside these moms. Not only is it a paradigm shift for me, but I know there's a paradigm shift going on in that room. And I want to empower almost everybody with this paradigm shift on their laptop button. Not just patients, not just me, but every single doctor. I hope that I can somehow help to promote this a bit further. It is particularly more challenging to remain decentered. If, for example, I'm seeing a patient for counseling, not so much of a medical problem, I have to be more careful not to jump in and offer advice. Since I've been in narrative practice, I've had a couple of patients who have come for more like for counseling. This is where I have been helped by supervision, and where I continuously have to go on using the maps of narrative therapy and make them take action after they have explored the effects and understanding their own hopes and dreams, brightening up their stars of their preferred stories. What I have noticed is that it requires tremendous skill, and it isn't as easy as it looks. And I salute all of us who are hoping to get better at this. It is important to constantly ask, what is my intention behind the questions I'm asking, and what do I hope to achieve? And this is the dominant thought that I have to keep in my mind all the time. And this constant moving from a centered to a decentered position and back is challenging, but will work. It is an ongoing process, one which I hope will never cease. It brings an image to my mind. This image is that of Samudra Manthan or Amrit Manthan. I imagine myself as that rock in the middle, mountain in the middle, who's being constantly churned from one end to the other end, trying to be centered and then decentered again. And we all know that when the Samudra Manthan happened, what came out was the sweet Amrit or nectar of life. That maybe that's me, not the goddess there. And this churning, this actual churning that I'm experiencing, I hope that everyone has the possibility of experiencing this churning. And everybody gets to understand how to get the balance right. And this churning, I'm sure, will become less aggressive as time goes, and it'll be more and more subtle and more nuanced. Dear academicians, this image brought another image to my mind. The similarity struck me as ironical. This is the study of the medical symbol. This is the medical symbol. And it made me wonder about the significance of these two serpents and how the medical profession symbol is suggestive of a churning every doctor must constantly experience to become more and more nuanced in the way we approach our patients. It is my sincere appeal, dear Academy, that we include elements of narrative therapy in our teaching program for all our junior doctors. Thank you.